where we have, you know, the terrible floods that happened across the city, and many people lost their homes and have had to move into very temporary camping situations. And of course we have inevitably, unfortunately, had a few cholera cases there, but UNICEF and partners working very closely and round the clock with all of those vulnerable communities to really promote hand washing and hygiene, to encourage the use of safe water, and to really ensure that the spread of the disease is minimized.
When you say UNICEF and its partners, I wonder how the Hygiene Behavioral Change Coalition in Nigeria facilitates public-private partnerships to especially advance sustainability and, you know, social value in vulnerable communities especially.
So definitely there's a lot of private sector partners involved in hand washing, and I think you'll see that in evidence at the Hand Washing Day celebration events. So partners are really involved at different levels, both at policy level, but I think mostly at the implementation level, in terms of supporting local communities and schools and institutions to promote safe hand washing.
Okay, great, perfect. Now let's talk about, you know, some perhaps tailored wash interventions and strategies, you know, that have been quite effective in high-risk settings, like, you know, the IDP camps you mentioned earlier when you talked about what took place or what happened in Maiduguri. I wonder how, you know, some of these interventions have managed to improve health outcomes and, you know, ultimately reduced morbidity.
Well, I think this is slightly the problem, is that when we promote hand washing in an emergency and then the cholera stops, people think, oh, we don't have to wash our hands anymore.
Great. So you see, and that's a problem there.
Yes.
You know?
That is really a problem right there. And so my concern is to ensure that it's a lifetime behavior change, not just an emergency behavior change. So
yes,
we promote that all of the time.